Thank you for joining us today. My name is Janik Goryeb, and I'm the Health Information Specialist with Brain Tumor Foundation of Canada. Today we have Maureen Parkinson, Vocational and Rehabilitation Counsellor at BC Cancer Agency from Vancouver, BC. Maureen Parkinson has worked for over 20 years as a Vocational and Rehabilitation Counsellor at the BC Cancer Agency. Prior to that, she worked as a Vocational Rehabilitation Counsellor at the GF Strong Rehabilitation Hospital and in the private sector, and as an instructor for career exploration programs. She has a Master's in Counseling Psychology and is a Canadian Certified Rehabilitation Counselor and has completed the Certified Return to Work Coordinator Program through the National Institute for Disability Management and Research. She has written articles both in print and online and a workbook on return to work and is currently researching work, function, and psychosocial issues for those who have had a brain tumor. Today's presentation, Maureen will be presenting on returning to work for those who have had a brain tumor, and I'll hand it over to you, Maureen.
Okay, thank you. Thank you to the Brain Tumor Foundation for the invitation to speak today. Because the topic of brain tumors and work is a rather large field, I'm actually going to focus today on things to consider when returning to work at your former place of employment after having a brain tumor. Although this talk is open to those that have had a brain tumor and healthcare professionals, I will direct my talk to those who have had a brain tumor. For health professionals, I hope this presentation gives you an idea on how to guide those who are considering return to work and gives some ideas and some helpful resources. Just also as a caveat, at the BC Cancer Agency, I work mostly with those who have had a brain tumor and typically only see people that are struggling or we have concerns. I often don't see or hear of those that are doing well when they're back to work. So while this information I'm going to discuss I feel will be helpful to anyone, I am going to focus in on some of the challenges or anticipating some of the challenges in terms of return to work and having a brain tumor. And that's not to say that everybody has these challenges. So today I'd like to briefly discuss some of the following topics as it pertains to return to work. So many are keen to return to work after brain tumor as it provides rewards such as a chance to contribute, developing expertise, a rhythm and structure to your day, a chance to socialize, of course financial support, and can be a mark of a sign of recovery after having a brain tumor. As most of my experiences working with those who've been diagnosed with a malignant tumor, I found two things may have changed as a result of having such a tumor. Firstly, for some, the history of brain tumor and treatment may change one's ability to function at work. And for others, in light of having a brain tumor, they may think differently about their work and home life and could potentially see work as more or less important or more stressful. And I feel this is particularly true for those who have a brain tumor with a poor prognosis. And this underscores the need to be clear about some of the potential challenges to returning to work so that you can address any of these challenges early and ideally make a best plan for return to work, and in some cases not. There's scarce research out there looking at return to work and working rates for brain tumors. So far the research sort of shows the range varies for those who are working after had a brain tumor is 18 to 73%. But this depends on how the research has been done and the type of research. The research does suggest there are higher incidences of taking time off, disability, or quitting for those who have had brain tumors compared to others with other cancers. In light of these challenges, it's important to be thoughtful about return to work, obtain the best assessment and guidance, and reach out to the potential supports to give you the best chance of success. When considering work and brain cancer or brain tumor, there are three stages of assessment and support where assessment and support can be provided. If you continue to work or you're staying in the stage of job maintenance, and depending on the impact of your brain tumor treatment, you may need to be continually be monitored to see if you're coping, remaining productive, or whether you need accommodations, whether temporarily or permanently, that it can allow you to stay working. Intervention at the pre-vocational stage is everything that precedes your return to work and helps you become work ready, and that can include assessment and rehab. Worksite intervention can involve working with your employer and the employees, and often at the work site, and can include negotiating return to work, accommodations, modifications, employer-employee education, on-site assessments, job analysis, and job coaching. And job maintenance, as I mentioned, can involve troubleshooting problems while on the job and can include ongoing counseling support, job coaching, readjusting accommodation, continuing education, and communication with employers, employees, and insurance providers. And this recognizes that ongoing evaluation and adjustment may need to be there to help address the various job demands and your workability, and takes into account that a reevaluation may be needed to be responsive to any changes that are happening for you and to help ensure success. Not all jobs are created equal, and it's important to consider the challenges that you may have in light of the work that you do. For example, if you're noticing problems with memory or concentration, this might be more of an issue for you if you work as a manager opposed to a gardener. But if you're having problems with balance, this may be more of an issue if you work as a painter compared to somebody, as a painter, say if you're having to get out and climb on ladders, compared to somebody who, like a clerk who has to sit all day. Your support system also plays a factor in promoting return to work. Are there supports at home to allow you to return to work? So one example is if you're not able to drive and you're not able to use public transit, are there family members or loved ones that are able to help drive you to work if you cannot drive? Are healthcare providers able to give you the information you need to guide you and your employer? And do you have access to the type of healthcare services such as rehab that can help you maximize your abilities, your functional level, and guide the type of accommodations that you may need? Another consideration is your workplace culture, which can include the ability and the willingness of your employee, and for that matter employees, to support your return to work. This can vary depending on the industry, the attitudes of your managers, your coworkers, your relationships with others at work, the demands of the job, your attributes, the economic climate, and the availability of disability management to work, just to name a few. I'd like to introduce a resource that we created at the BC Cancer Agency called Cancer Returning to Work, a Practical Guide for Cancer Patients, which is available online for free. This booklet was based on our experience at the BC Cancer Agency for 20 years in providing vocational rehab support, what the research has been telling us, and from feedback from over 60 cancer survivors, employer representatives, lawyers, disability managers, insurance consultants, and healthcare providers. We feel the ideas created in this book can be helpful for those who are considering return to work after many illnesses and disabilities, and I encourage you to download it. Also, both healthcare providers and those that have coped with a brain tumor would very much appreciate your feedback on this, because we do sort of see this as a work in progress, and based on your feedback, we will attempt to approve it. So for today, I'll follow some of the general guidelines that are in this workbook and add additional points that I feel might be particularly helpful for those who have brain tumors. The Cancer Returning to Work booklet, a practical guide, provides 3 main content areas: developing a rehab plan, preparing the work site, and enhancing workplace well-being. So for today, I'll be focusing on developing a rehab plan and preparing the work site. Developing a rehab plan involves assessing your work abilities, all the while considering the work you do and other work that may be available to you at your workplace. Once you get a good assessment of your abilities and the demands of your job, you can compare these to determine if you can go back to your old job or another job at your workplace. Identifying discrepancies between workability and your job demands also allows you to consider what resources could be put in place, such as rehab, to assess and improve your workability. It's not unusual that your doctor will be asked to fill out forms for insurance companies or to write a letter to clear you medically to return to work. So it's important for your doctor to know what are the demands of your job to make recommendations. Sometimes the same job title can mean the same, different things. For example, a food server in one environment could mean just taking orders and clearing tables, or serving in another environment. It could involve cleaning up the restaurant after the shift is over. So based on your doctor's recommendation, your employer will determine whether they have a job ready for you or if they can make the necessary changes to enable you to work. So if you're applying for or receiving insurance, insurance providers will also be contacted with some of your doctors. So it's important for your doctors to know the challenges in the context of the job that you do. So there's 4 ways that you can potentially assess your job demands. A very common tool that's out there is a job analysis, and frequently you see these in large organizations, typically around physically demanding jobs. And what's helpful with those is they also may identify kind of the essential demands that your employer expects you to do. Another way to determine the demands of your job is just to simply look at your job description and see what it's telling you and how it's describing your job. The third is to do your own assessment, and you know, what I ask people to do is just to ask yourself every 15 minutes, what do you do in your job? But you may need to, given that sometimes job descriptions may vary daily or weekly or monthly, you may have to add in the occasional duties that you do periodically. At the BC Cancer Agency, we developed another way to determine your job demands to help you anticipate some of the work challenges and address this with your doctor and employer ahead of time. The BC Cancer Agency job analysis was developed looking at standard job analysis that are commonly used in the human resources field. And we encourage you to download this form and hand in the summary job analysis part to your doctors, because it condenses the information, for your doctors in a very quick and easy read way. We had 9 doctors or so evaluating this job analysis, and they were quite pleased. We've had quite positive feedback for them in terms of them sort of feeling it's been a helpful resource. The job analysis asks you to indicate what you can do or what your abilities are in the context of your job, and it's looking at certain strength requirements, physical demands, temperaments required, the psychological and cognitive demands, and the environmental conditions of your work. Well, while we ask you to assess whether you can do something or not, like standing, in the case of fatigue, you may have to add a little bit into the job analysis, because we ask you, are you able to do it, or are you not able to do? But it may not take into account that you may be able to do it, but how long can you do it for as long as it's expected, say, for your shift. So you may have to add that comment in terms of your summary that you give to your doctor. Of note, in the case of being assessed for insurance, you may need to assess your work capacity on an ongoing basis. So it might be helpful for you to periodically do your job analysis to hand in a summary of where you're at to your doctor. But if you're ready and getting close to starting to work, this can be helpful. I often feel that the ideal time to do job analysis, if you're looking at that, is ideally when your symptoms are relatively stable and kind of you have a good sense of that's what you'll be able to do. The second part of developing your own rehab plan is determine if your work abilities have changed. We know that for those who've had a brain tumor, depending on the size and location and treatment effects, there can be some changes, which can include ongoing problems with medical, physical, cognitive, behavioral, and psychological concerns that could impact your ability to do your job. Again, these are very individual. The degree of these changes can potentially influence where you can successfully return to your former job, another job, or whether you're better to stay off work and apply for benefits if it's available. Some of the challenges you can experience that potentially affect your work ability, realizing, again, this is individual. Medical, for example, having seizures and headaches. Physical changes, such as having challenges in balance and coordination. Strength, so it can be strength in arms, legs, hand strength, fatigue, changes in urine energy. Sensory changes that can affect your hearing, vision, touch, taste, or smell, and mobility or motor skills that affect, for example, walking. Cognitive changes could include a decline in memory, such as remembering names, words, instructions, appointments, and daily schedules. Attentions, one example of that might be tuning out distractions or staying focused. Learning new things, processing information or even speed of processing, solving new problems, thinking through and making decisions, planning out steps and following through on complex tasks, organizing your thoughts, being even aware of the challenges that you may have, which we call insight. Communication challenges can include word finding, understanding speech, ability to write, read, reading social cues from others, or stuttering. Behavioral and psychological challenges could include being more prone to being frustrated, which we call lowered frustration tolerance, being more impulsive, feeling more anxious, or having a lowered mood. It's important to be aware of your function in order to determine your strengths, to figure out how to highlight those strengths in your work situation, or avoid or work around the weaknesses that you may have in your job, to help you see how your strengths and weaknesses measure against the demands of the job that you do, and help you determine if you can do your job or another job, and highlight what skills that capitalize on your strengths and minimize your weaknesses, and to identify what can be changed to the workplace, which we call accommodations, to help you do your job. As mentioned, there are several ways to assess your work abilities. The self-assessment is a good start for you, and this is very helpful because odds are you're going to be advising your doctor of your capacity and your feelings about your work readiness. The second is the physician assessment, which is typically informed by what you're telling them. The third is more of a formal assessment, either by a rehab professional or a psychologist. And the fourth is an on-the-job assessment, such as a graduated return-to-work trial. So when it comes to self-assessments, it might be helpful for you to ask yourself, have you noticed if your abilities have changed since you first had symptoms of your brain tumor? Are you noticing that your abilities to do activities such as chores, gardening, shopping, handling your finances, or cooking, have they kind of declined? Have your abilities, have others, typically say your partner or family members, commented on your ability to do things in the same way? And with this information, reflect or consider how these changes might affect your ability to do your job. Another important thing to assess is your energy level. I used to teach employment programs to those who were unemployed and had no health challenges, and they were always surprised after being off work for a period of time and attending a classroom how exhausted they were. They basically lost their work conditioning. For those who have brain tumor, fatigue could even be more challenging. So assessing and improving your energy level can be more important to your ability to do your work. So one way to assess your energy is to systematically track your energy. So in the Cancer Returning to Work Practical Guide on page 65, we have featured an energy log. And knowing your energy level and following this energy log can be very helpful to you considering the energy demands required of you at the work and how you can manage them so that you can work most productively. So, for example, if you find you're more energetic in the morning, you may want to do demanding tasks at that time. As well, you may find taking a nap or getting outside at lunchtime may bring your energy up, and this might help you be able to work full-time. And I think about, I have one example of somebody who was working in the forestry field, and the difference with him working full-time or part-time was he used to have a power snooze at lunchtime in the back of his pickup King cab, and that allowed him to be able to work full-time. So in knowing these activities that energize or drain you can help you determine what needs to be done to allow you to work at the maximum capacity. A second way to assess your function is to do a work simulation. So given that you have the okay to do this by your doctor and you're not putting yourself at risk for accident or a healthcare provider, like a rehab specialist, try performing tasks that are similar to the work. So if your job requires accounting tasks, sit down in your desk and do your accounts or your income tax. If your job requires more physical abilities, do housekeeping and yard chores. Try and do them the same time you would be doing your work to see how long you can go before you need to take a break. It's also important to I encourage people to start sort of shifting their sleep, wake up and sleep cycles. So you're starting to do this work simulation around the same time that you're starting work. Because it's very important to kind of get a sense if sleep is going to be one of those things that may impact your work ability, so you can problem solve with your doctor about that sooner rather than later. So another way to assess yourself is to use volunteering. So for example, if you're sort of noticing that you're having more challenges with multitasking, sometimes volunteering by, say, coordinating an event gives you a sense to kind of test yourself in a sort of a safer environment. But of note, some insurance plans consider volunteering work. So I would check out volunteering doesn't kind of hurt your access to your claim. Another way to self-assess yourself, and ideally to bring up your energy, is to do enjoyable activities. I often recommend that for people that are coping with depression. Sometimes you don't want to start with the chores, you want to start with things that you enjoy doing. Because typically when you do things you love, you're more likely to lose yourself in that activity, and it allows you to sort of nudge your conditioning a bit. And the last is sort of the graduated return to work trial. To determine whether you're facing low to high barriers of return to work, there's a website that was developed in British Columbia called Brainstream. And it provides, and I believe actually this self-assessment was developed by a voc counselor and occupational therapist at GF Strong, which is our local rehab hospital in Vancouver. And they provided a checklist to help people think or rethink about employment. And they asked you to rate your challenges with sleep, headaches, seizures, thinking skills, emotional well-being, and mobility. Discussing with your doctors what to expect in terms of recovery will also help you plan for your return. It may be important for you to know what to expect in terms of recovery, how long this will take, will your function become better, where your function will level off, will you resume full function, and when will this happen. So while your doctor may not know all these answers, they may help you get a sense of what to expect, and this might be helpful to you and your employer in determining a potential return to work date. As mentioned, discussing with your doctor your function and your job demands will help your doctor be informed when completing insurance forms, determining whether you're fit to return to work, help you guide your employer on disability accommodations that you may require, and refer you to services to assess and rehabilitate your functional challenges. So types of assessments and interventions that your doctor or healthcare team could potentially refer you to or recommend to insurance providers that they provide could include physio, neuropsychology, occupational therapy, kinesiology, speech and language therapy, psychology, social work, or psychiatry. Again, referrals to these sources would be depending on the effect of your brain tumor and the treatment. So I'd like to zero in on two disciplines, the first being neuropsychology. Particularly if your job requires a lot of thinking, memory, multitasking, and you notice challenges there, a work-oriented neuropsych assessment can be helpful. It can help you determine your strengths and weaknesses, provide a guide to what you can do, and put in place and what needs to be put in place to help improve your function, or provide an opinion of whether you can do your work or not, or actually, for that matter, whether you can work. This assessment may also help sort out if a change in your function is because of a brain injury or psychological reasons. A neuropsychologist is a trained psychologist both in the areas of psychology and brain function. They sometimes provide help in anticipating work challenges and recommend compensatory strategies to overcome these and outline ideas for work accommodation. one of the challenges of getting a neuropsych is they're often quite lengthy and expensive, and sometimes not readily available. Sometimes, if an a private insurance provider is involved, I sometimes encourage doctors to recommend that such assessments be provided before someone's clear to return to work, or recommended as part of rehabilitation. Another helpful discipline that I'm going to speak about is occupational therapy. They can be particularly, or OT as it's sort of shortened and called. An OT can be particularly helpful in aiding someone back to work. They can do what's called a functional or physical capacity evaluation, which basically involves analyzing the tasks of your job and then formally measuring your ability to do those tasks. So, for example, if you have some difficulty with right-sided weakness and lifting could potentially be a problem, an OT might assess what you could lift safely before that doesn't sort of cause injury. But more importantly, they might suggest adaptive aids like lifting mechanisms to allow you to keep doing your job. If you have cognitive complaints, the OT might give you some ideas on how to set up your work environment. One example is, say, reducing noise so you're not distracted. Another might be organizing tasks so you can work as quickly and as efficiently as possible, or introducing memory aids to allow you to do your work to the best of your ability, or even give you ideas on how to manage your fatigue so you can work longer and reduce making mistakes. A work-oriented occupational therapy assessment would be particularly helpful to you and your employer, as it gives you and your employer practical ideas that you can use and bring into the workplace. I see many employers that want to support people back to work, but they may not have the expertise to know how to help you to be successful. And I do feel occupational therapists can be very helpful there. And in some cases, OTs can design work hardening programs, which are essentially exercise programs sort of based on the job that you're doing that can bring your conditioning up to the work demands that are required of you. Both neuropsych and occupational therapists can teach compensatory strategies, and I kind of see this as for the most part, teaching common sense strategies to help you overcome some of the functional challenges. Examples of strategies: one, restoration techniques could include understanding and staying within your energy limits, teaching you memory, thinking, concentration strategies such as distraction reduction, organizing yourself, breaking tasks down into small chunks, using repetition to kind of sort of remember things, using cues, cards and Post-it notes or your workstation to help with memory, doing one thing at a time so you can stay at task, making lists, and kind of looking at your job and sort of providing guidance about doing tasks that times of the day that you might be most efficient. They can also recommend adaptive aids such as modifying the workstation, changing the keyboard, say for somebody who can only use one hand, sourcing and identifying voice reminder systems, beeping cell phones, and making recommendations for mobility aids such as scooters or voice-activated software so you may not have to type. So where do you get these assessments? Typically, neuro-focused rehab assessments, you may find them in some cancer centers if you're lucky, general hospitals or rehab hospitals, and sometimes it'll be some degree of it will be available through community care or home care systems. You may find that some of the community care rehab may not be as work-focused and may vary in terms of neuro expertise. But another source for rehab assessment is through private insurance, whether it's long-term disability or extended healthcare benefits. So it's worth exploring what's available to you. These benefits can vary on the benefit plan that your employer has purchased. As well, some provincial vocational rehab programs may provide access to such assessments if they feel it's helpful in vocational rehabilitation planning. And as well, sometimes CPB could provide assessments if they feel it's indicated in your vocational rehab. But again, this will determine on whether the case manager or coordinator of that program feels this will be helpful to you in terms of helping you return to work. I'm going to just change gears and talk a little bit about insurance. If you have access to private insurance, such as short-term and long-term disability, there can be advantages of reviewing your policy more closely to help you plan for the future. Another reason to review the plan early is to consider what you will do, what do you need to do if you can't return to your old job. Of note, many of the long-term disability plans at the 2-year mark may have a definition of eligibility, and that's why it's really helpful to look at your plan early. So if it's not likely that you can return to your former work, it can be helpful to plan early and at least discuss with your doctor the likelihood of you being able to work at another job so that you know what's coming next. So this could mean potentially staying on the plan if you can't work at anything, or can you take the steps to prepare for a new job. The other advantage of looking at work situation and insurance early is that sometimes long-term disability, and for that matter, Canada Pension Plan, may fund some voc rehab programs if they feel it's likely that it's going to help you to return to work. And of note, usually that funding comes closer to the time that you're ready to return to work. It isn't really sort of upfront early on rehab. As well as insurance companies may have in-house vocational rehab programs available to help you overcome barriers to return to work. Voc rehab counselors may help in intervening on behalf of your employer, and in some cases may recommend and fund work-related rehab services. As I mentioned, CPP disability may have a source of voc rehab support. Just as an aside, don't be surprised if you're on long-term disability that at some point they're going to ask you to apply for Canada Pension Plan. Many plans state that they'll fund you a certain percentage minus any eligible benefits, and that can include CPP disability. This is a way that they offset the cost that they have to pay you. As mentioned, it's in your interest to review your insurance plan, private insurance plan, early to avoid any unexpected, unpleasant surprises and help you to plan if you need to. And if you're considering to return to work, you might want to ask your insurance provider a few questions. If you do a graduated to return to work, for example, how long will the benefits last if you do this over a period of time? When or will the benefits stop if you reach a threshold of income or hours? And if you return to work while on short-term or long-term disability, how long does this last before it's considered a new claim? Should you have to stop working again because of your brain tumor? So focusing more on the workplace, the research in disability, illness, and cancer is sort of strongly showing that one of the positive indicators for return to work is support from your workplace, and that includes from your employers, your supervisors, and your colleagues. So I sort of feel it's important for you to maintain your support and the goodwill at your workplace while you're off. And often this can be done by maintaining contact with the workplace. So this can include attending holiday parties, having coffee or tea with friends and colleagues at work. And I think if you plan to return to work, you may want to advise your employer that you do plan to return and that you want to return to your former work and workplace. And if possible, based on your discussion with your doctor, there may be advantage of telling them a time frame when you expect to return. Sometimes you may want to be generous with that time frame just to take into account that there may be side effects and treatments, but sometimes it definitely is an advantage to saying that you're expecting to come by that date for a few reasons. One of them, so they can hold your job, and the second so they can make the plans for you to return. And my source at BC Human Rights Coalition says if you're not able to even guess that, sometimes it's even helpful to say that at this time, or your doctor say at this time, that you'll be assessed in terms of looking at your work readiness. Along these lines, there are human rights to protect you, but there are limits. So I think it's important to kind of create goodwill for yourself at the workplace. So ideally, they hold your job for you. So when it comes to disclosing at your workplace about your brain tumor and how it affects your workability, there's pros and cons. The pro is to get the accommodations and the support you need to be able to do your job, to explain the absence to prevent employers, supervisor, colleagues filling in the blanks in a negative way. So say if you've been off for an extended period of time, you don't want them to misinterpret that you're trying to avoid working. And also to educate others on what's happened to you so they can hopefully understand and have empathy for your experience. The downside of exposure can also be the potentially work-related discrimination. But for the most part, while the research is telling us there is a benefit disclosing some aspects of your illness, for others, they have found that sometimes it isn't always helpful. So there has been a U of T study done by Stewart. She asked breast cancer survivors how they felt and retrospectively about disclosure. Of the 50% who disclosed at work, the majority felt it had a positive effect with their relationships at work, but 17% felt it negatively affected things. So I'm not aware of any studies out there around disclosure of having a brain tumor. So I think you need to take into account what might work for you in your work environment around that. The flip side is, in order for you to do your work in a productive way, it may be important for you to disclose to your employer what you're struggling with and how things may need to change in your workplace to allow you to do your job, which we call accommodations. I think it's particularly, it is important to disclose if there's safety issues about you doing your job. One example is, say, if you're coping with the seizures or you have some difficulties with attention, it might impact your ability to do machine operation, for example, such as working on tools or driving vehicles. In the case of driving vehicles, you may need to consult also with your provincial motor vehicles legislating body or motor vehicle insurance to ensure that you're okay. And another thing to consider is just because you've been cleared to drive your household car, your home car, doesn't necessarily mean you're cleared to drive a long-haul truck. So it's worth kind of exploring that. If you have difficulty with memory or concentration, possibly remembering to do things like giving medication, say if you're a nurse, could be an issue for you. So I would sort of suggest starting by discussing with your doctor or healthcare provider to rule out that you might be risk for these safety concerns at your work. So ideally you could disclose these challenges and the need for accommodation early and help you to start a dialogue with your employer about what needs to be put in place at your work to help you work at the most safe and productive level. It might be also helpful for you to think ahead of time who you need to tell how much and when about some of the challenges that you may have that have come from brain tumor, having a brain tumor treatment. In order to get the accommodations you need, you may need to, as mentioned, you may need to disclose to your employer or supervisor. You may want to consider what are the consequences of not telling your colleagues. But you don't have to tell the nitty-gritty, or the whole story. You might consider with your colleagues that you're going to disclose on an as-needed basis. So say with your inner circle colleagues, it may help you for them to understand a little more to help you, but do people from other departments need to know full information about you? Similarly, if you're planning to disclose information about your disability, you may want to also consider the timing of when you do disclosure. there might be an advantage of disclosing things before you return to your job. So ask yourself, well, talking about your tumor, the impact of that make you feel flustered if you're going back, if you're back at work? Will it add to your stress, say, of your first day or your first days at work? In some cases, in my experience, people that don't want to talk about their history of tumor, sometimes it can be just helpful to kind of say, I call it sandwiching, which is kind of saying it kindly, saying thanks for asking about my health. I appreciate that you're showing that you care. But do you mind if we don't talk about it? I'm wanting to put that behind me. I think, again, you'll know what works best for you in your workplace. So as mentioned, I talked a bit about accommodation, and I'd like to go a little more on talking about the types that are available or potentially available that could be implemented into the workplace. The one and the most common is the transitional work processes, graduated return to work. Another could be modifying schedules, such as working at different times, starting later. For example, there could be advantages starting later so you avoid the rush hour traffic, so you're not spending your prime energy time fighting the traffic. Another modification could be modifying or acquiring equipment, and an example could be adapting a keyboard, modifying or acquiring new equipment, such as changing your computer screens so you can see larger print if you have problems with vision, using a personal memory device to help you remembering appointments. You could also modify there could also be modifications to the worksite, such as replacing steps and putting in ramps, or providing noise proofing, so to prevent you from being distracted. Job modifications could be choosing the task or choosing to do more complex things in the morning if you're more fresh at that time. And if all fails, reassignment to available positions. So if you look on the job accommodation network, there are ideas that were generated by U.S. employers to give types of examples of accommodations that potentially could be introduced in the workplace. Note these come from the U.S. They're just suggestions, and they're not mandated by Canadian law, but they do provide some good ideas. An example, say, of a job accommodation under, say, brain injury could be for maintaining concentration, could be reducing distractions in the work area, providing space enclosures or a private office, allowing the use of white noise or environmental sound machines, allowing an employee to play soothing music. And these are just but a few. Like under that category, there's also, under brain injury, there's things like helping with memory and fatigue. So these are just a few of the accommodations that are on the website. So I'd encourage you to look at them. So switching now to human rights, between provinces there can be some variations in terms of human rights. And it's important to know that that human rights are often influenced by the court cases that are won prior to that point. So it can always change. So I often encourage people, if they're wanting to know about human rights, to reach out to the experts in this area. But for the most part in Canada, human rights legislation infers that the employer has a duty to accommodate someone with a disability unless they can prove undue hardship. And this can include that the employer modifies duties and practice related to your present position as recommended by your doctors or your healthcare team, but mostly doctors, actually, showing that their attempt to accommodate you were conscientious and serious, and all the while showing an effort to prevent discrimination or harassment based on disability not to be allowed at your workplace. You also, employees, as an employee, also have an obligation, one being to provide information on what, based on disability, you need, providing sufficient information to the employer so that you're able to, so they're able to adequately assess how they can reasonably accommodate you in that work situation. supplying them job-relevant medical information, such as your limitations in your current capacities, and being cooperative. And I think part of being cooperative, not expecting it's very much a negotiated process, not expecting the perfect accommodation, but being open to an accommodation, the attempts by your employer. Just as a note, if your employer reasonably accommodates you and you decline this, in some cases it can be grounds for dismissal. So if this happens to you, I probably wouldn't encourage you to say, no, I'm not going to accept that. I would encourage you to reach out to the appropriate expertise in human rights to get some guidance there. So it's important to address any psychological concerns because this too can negatively impact your ability to work. We know from the research that those who have had brain tumors may experience sort of elevated distress, and that can affect your ability. At the BC Cancer Agency, we routinely offer return-to-work groups, and often the pursuing workplace well-being is the most popular part of the course, and often the reason why people sign up for this workshop. And mostly because people want to kind of look at better ways to handle their stress and also kind of to improve their overall quality of life. They want it at work. They want the life to be sort of better in light of kind of the experience they've gone through. I feel in the case of somebody who's been coping with a brain tumor, there's some huge advantages in getting on top of stress. We find that stress, when you're experiencing stress, and it can be very fatiguing, and if you have, again, because of brain tumor, issues with fatigue, that's one thing you can do to at least minimize the impact on your, the negative impact on your energy. The other thing is if you're having challenges with cognition, again, stress can also make things worse. So again, looking at becoming skilled at stress management techniques will only help you in terms of weathering that better. Out there, one of the most effective non-medication ways to deal with anxiety and depression is the cognitive behavioral therapy. Also, what we found is great Canadian research that's been done that shows that mindful-based stress reduction has been very helpful to people in reducing their distress. But even learning other techniques like relaxation, breathing, time management, problem solving, improving your communication skills like learning assertiveness and negotiation skills can all help you in terms of addressing fatigue, which ultimately, or addressing stress, which may negatively reduce your work ability. Sadly, in the area of job maintenance, there isn't a lot of guidance out there to help people, and I think it's an area that deserves a lot more focus. We do see that people, in some cases, struggle to remain at work once back to work. So I would encourage you to try and open the lines of communication with your employer if your work ability has changed and your function's gone down, just to sort of regularly check in and problem solve solutions to help you be effective. It's also important to consider the demands of you at home. You know, if you have high demands at home, this could have an impact on your ability to work. And, you know, I think about, you know, childcare, for example. If you're having some problems with looking after a baby during the night or whatever, things like that, and affects your sleep, that might have a negative ability on your ability to handle fatigue at work the next day. If you're struggling, I think it's important to keep your doctor notified of this, because in some cases they may need to write a letter outlining more need for accommodation for you, or, you know, in some cases allowing you some more time off to recover. And finally, I think it's important to be open that you may need to continually assess your situation and constantly look at ways to look at accommodating, looking at ways to tweak and modify the things that are in place for your work to help you improve your productivity. So as mentioned, I've mentioned a few of these resources here, and I think there's a few more of those, and these are some of the few of my favorite resources that could be helpful in terms of looking at helpful ideas around return to work. So I'd like to finish with saying, before I did this talk, I consulted with the BC Neuro-Oncology Patient and Family Advisory Group and some members of the brain tumor support group that we do in Vancouver, and I asked them to sort of relay advice they would give to you about returning to work. And their comments is they reported that they were surprised that things had changed for them when they returned to work, causing them to evaluate their work and whether they wanted to do things the same way or whether they wanted to do something else. So they suggested it might be helpful for you to consider and be prepared that this may happen to you. So I hope this talk gives you some ideas on how to prepare for return to work and give you some tools to anticipate and overcome any challenges that may arrive. And I do wish you all the best in this process. Thanks again for allowing me to share these ideas.
Great. Excuse me. Great. Thanks so much, Maureen. Great presentation with a lot of really great and practical suggestions and information. Did you want me to do those 2 poll questions right now for you?
Yeah, that'd be great.
Great.
Thank you.
So we have 2 more questions for everybody who is online with us. And for those of you who are brain tumor survivors, are you currently actively working in a paid position? Yes or no? Give you a second to answer that. Okay, it looks like it's 50-50. And then for those of you who are working in a paid job, are you working full-time, part-time, or casual? I'll give you a second to answer that. Great. And it looks like we have, Maureen, 67% of the people online are working full-time and 33% are casual. Okay, so that's great information for you, right? And for the resources and information that you guys are always gathering at BC Cancer Agency. Yeah. It doesn't look like there's any questions right now, but we'll just give people a moment, if there are any questions, to type those up in the chat section. Yeah.
I wanted to mention, it's great that there's so many people that are working full-time. One of the things with this return to work booklet practical guide that we've developed is we don't have a lot of feedback from people that are back to work, so it would be so great if people could review that. We have that online at the BC Cancer Agency website because, again, you know, looking back, if you look back now and think there's information that could be helpful for you, that would be very helpful for us in terms of improving that booklet.
Great, and we'll make sure that we actually have a link to that booklet on our website, Maureen. And then what we can also do is for people who registered, regardless if they're online or not today, we can maybe email them that link also.
Excellent.
And we can do that from our end, no problem. It doesn't look like there's any questions. I'll still give people another minute or so. I'm just going to switch the slides for a second, Maureen, so that I'm presenter, so I can show everybody just a quick slide regarding our next webinar. There we go. So just an FYI that our next webinar and our last webinar of the year is going to be on December 17th at 12 p.m. Eastern Standard Time. It's going to be on the topic of cognitive effects of brain tumors in treatment, and Dr. Mariani from the Northeast Cancer Center in Sudbury will be joining us for that. This was the first year that we provided a 12-month webinar series, so we're going to be assessing for 2015. We will be offering some webinars in 2015, but more than likely not a full 12, as we just don't want to reinvent the wheel. But if you do have suggestions on topics for 2015, when you do receive our survey, please let us know, and we'll do our best to accommodate and or refer people to the programs and resources that they need. So a big thank you again to Maureen for taking time out of your schedule to join us today. Really great presentation, very practical information. And you're welcome. And this presentation has been recorded, so it will be up on our website in the next week or so. And for those people who did miss it, we will make sure we send out an email to them to let them know that the video is up on our website. And it doesn't look like there's any questions right now, but maybe there is one more question. Just 1 second here. Oh, just a comment that thank you for your work and great presentation. So a comment from one of our audience members.
Oh, awesome. Nice.
And for anybody who thinks of any questions later, please feel free to email me. My email address is right there, and I can forward those questions to Maureen. Okay, so thanks again for joining us, everybody, and have a great rest of the day.
Okay.
Thank you.